Magnetic compression anastomosis for patients with a disconnected bile duct after living donor-related liver transplantation, a pilot study. Introduction. Endoscopic and percutaneous biliary interventions may fail in patients with a disconnected bile duct after living donor-related liver transplantation, LDLT. Fit patients with a disconnected bile duct may undergo biliary reconstructive surgery, which has a high morbidity and mortality. Those who are deemed unsuitable for surgery, however, live with a permanent percutaneous external biliary drainage catheter. The magnetic compression anastomosis (MCA) technique for biliary recanalization is well reported for these patients. However, the magnets that were previously used were 4 to 5 millimeters in diameter, and large diameter magnets cause marked difficulties during endoscopic and percutaneous procedures. Recently, a new through-the-scope magnet with a 2.4 millimeter diameter was introduced for biliary recanalization in a single LDLT patient with disconnected bile duct. In this study, Ersoz et al. Present the use of the MCA technique using this recently introduced through-the-scope magnet for disconnected bile duct in further LDLT patients. Background and study aims. The authors present the use of the magnetic compression anastomosis (MCA) technique for treatment of disconnected bile duct after living donor-related liver transplantation (LDLT) using the recently introduced through-the-scope magnet. Patients and methods. The MCA technique was used in patients with disconnected bile duct who could not be treated with either percutaneous or endoscopic procedures. All patients already had a percutaneous external biliary drainage catheter before the procedure. The magnet was placed percutaneously into the proximal side of the obstruction by pushing a 5 French catheter over a guide wire. Concurrently, endoscopic retrograde cholangiopancreatography (ERCP), including endoscopic papillary sphincterotomy, was performed. The sister magnet was then carefully advanced to the opposite side of the obstruction with a 5 French catheter over a guide wire. After the confirmation of biliary recanalization, a guide wire was passed through the stricture and a percutaneous dilation of the stricture was performed with a balloon-tipped catheter. Endoscopic balloon dilation of the stricture, insertion of 2 plastic stents, and the removal of the internal drainage catheter were performed during the first ERCP session. Stent exchanged and multiple side-by-side stent placements were planned at regular intervals, 3 monthly, for all patients. Results: a total of 6 LDLT patients with disconnected bile duct, aged 37 to 68, 4 men, underwent the MCA technique between September 2014 and July 2015. Biliary recanalization was achieved 13 to 42 days after the magnet placement procedure. The success rate of the procedure was 100%. Conclusion: the MCA technique using a small magnet, diameter 2.4 millimeters, is effective and useful in LDLT patients with disconnected bile duct.